One of the discussions we're having here at the conference is what governments can do to create an enabling environment for PPPs. We've heard about taxes, imports of medical equipment. Could you talk about what very specifically governments can do to create those relationships?
So what's been cross-cutting and is coming out as a common agenda for all the countries is a strong regulatory framework. Create an enabling environment with predictable laws. And if the regulations and policies are sound, this will enable the private sector to carry on expanding and probably even beyond the borders, so that it can have free movement of goods, labor and services. That will impact healthcare very significantly. It will reduce the cost, it will improve quality. Let me give you one specific example. Like if we have a manufacturer who's producing anti-malarials in Gambia, if they register that product with the regulatory authority, they should be able to sell that product in the 15 countries in West Africa and not go through the bureaucracy and almost wait 2 years in some cases before the product is available in the other country. So it's the cost and the time and actually the bureaucracy involved in setting up a movement of your products. Another example is a doctor trained in Rwanda should be able to work maybe in Tanzania, which will be just in the East African community with similar disease trends. So if we are able to harmonize laws and policies around the regions, that would be extremely beneficial. That's what the private sector is looking for. A level playing field, predictable areas in the legislative framework in health, and improved coordination.
And how do you go about doing that? What are some of the first steps to have coordinated laws and structures?
So we need to understand what the existing laws are. The first step is start from every country, look at what the existing laws are and how are they discordant, or in what are the differences between these countries that are in the neighboring zone. So at least for Africa, the start has been we've created economic zones. We've got several economic zones that covers most of Africa. There seems to be an agreement or a treaty around East Africa Community and ECOWAS that we will have an attempt to create free movement of health commodities across. So we need to start understanding that and getting that through to all the countries and enabling the private sector to give a feedback on these laws and look at where the bottlenecks are. Once we understand that, we start creating what is the best practice, not only within Africa but also around the world. Should we have any VAT or duties on raw materials? Should we tax diagnostic services? Should we make work permits free of charge for all health workers that are moving within the region? So these are some concrete examples that I think are quick wins.